Good evening, and welcome to episode 9 of the Hope for Healing video podcast series. I'm Dr. John Stracks, joining you from my office in Chicago. I'm here this evening with my friend and colleague, Dr. Elisa Batson, who's a psychiatrist and mind-body medicine practitioner in Nashville, Tennessee. Before I introduce Dr. Batson, let me tell you a little bit about Hope for Healing. Hope for Healing is a joint effort between the Curable app and me, and I know most of you are familiar with both of us. For those who don't know one or the other, I'm a physician with a mind-body medicine practice in the Chicago area focused on the reduction and elimination of physical symptoms using mind-body medicine methods. Curable is an amazing app focused on the same goal. We've been working together since their inception about 5 years ago. We started this series at the beginning of the COVID-19 pandemic, as we both thought about what we could do that would help support people during this difficult time. Before we get started, I want to go over just a few items. First of all, Dr. Batson and I will be discussing mind-body medicine for 45 or 60 minutes, and then spend some time taking questions at the end. Our friends at Curable will collate those for us and deliver the questions to us during the Q&A. So if you have questions at any point while we're talking, go ahead and type them into the chat box on Zoom, if you're watching with us on Zoom, or into the Facebook feed if you're joining us on Facebook Live. Curable's monitoring both areas, and so you can type your questions at any time, and we'll do our best to answer as many as we can at the end. Secondly, and I'll go over this again at the end, I want you to know that I have been able to expand my telehealth practice significantly during the COVID-19 pandemic, and I'm working to sustain that indefinitely once the pandemic is over. So that means no matter where you are, if you're feeling stuck with your symptoms, you can go ahead and reach out to my office at www.drstracks.com. We can give you details about what it would look like to talk directly with me about your situation. And lastly, I want to spend just a minute talking about terminology. Most of you know what we're discussing is mind-body medicine, which to me means that our bodies can express for us what's going on in our mind or in our lives. That's universal. It's not bad. It only becomes, quote, bad if you enter a medical system that doesn't understand this and assumes that all physical symptoms are physical in origin. Humans, I believe, have always expressed their lives in their bodies and likely always will. Our goal is to help you understand that, to learn what to do about it, so it's no longer physically uncomfortable or painful for you. I learned about this concept initially from a physician named Dr. John Sarno, who many of you have probably heard of as well. Dr. Sarno was a physiatrist in New York City in the 1960s who really understood this connection well between mind and body, was the first one to popularize the work. He called the concept tension myositis syndrome, or TMS, which is a term that I've used for years. But now that we have a much better understanding of the concept and the science behind it, I preferentially use the term mind-body medicine, but occasionally you'll hear me or Dr. Batson slip and use TMS. Just know that no matter what I call it, we're referring to this concept, that what happens in our lives shows up in our bodies. And that doesn't make us bad or make us sick. It just makes us human. So with that, let me introduce Dr. Elisa Batson. Dr. Batson completed her residency training at the University of Iowa Hospitals and Clinics, receiving dual training in both internal medicine and psychiatry. During her career, she's had the opportunity to work in adult primary care, inpatient psychiatry, consultation liaison services, and outpatient mental health care settings, taking care of those with severe and persistent mental illness. However, it was when she herself developed chronic pain that she really began her journey in understanding how the mind interacts with the body, and does so to create both pain and eventually healing. So over the next hour or so, she'll talk about what she's learned both personally and professionally during that 10-year journey with pain. In partnership with our friend and colleague, Dr. Howard Schubiner, Dr. Batson developed a chronic pain, anxiety, and depression recovery program called Take Back Your Life for Centerstone, Tennessee, which is a not-for-profit healthcare organization. She sits, as do I, on the scientific advisory board of Curable, and she currently works at Centerstone, Tennessee, where she helps guide others in their recovery from chronic pain in addition to taking care of mental health issues. When she's not working, she likes to spend time with her husband on their farm near Nashville or in the Tennessee mountains. She's graciously agreed to join me here tonight on this episode to talk about both her own personal experience and about how she's adapted that experience toward working with clients to help them overcome their battle with chronic pain and other symptoms. Elisa, welcome to Hope for Healing.
Thank you, John. I really appreciate it. I'm really happy to be here, and I'm honored. I love most trying to help other people who are going through the same pain journey that I went through, and so this is always a great opportunity for me, and I hope I can be helpful tonight.
Good. I'm thrilled that you're here. You and I met, I feel like it was 3 or 4 years ago, maybe even before then, just because of our mutual interest in mind-body medicine, and compared some of our own stories about how we got here. As you know, so many people come into this field because they've had their own health issues that have gotten better this way. And so a lot of people have heard me talk about my own story on various Curable podcasts. And I think you've done a Curable podcast with Laura Sego as well. You know, for me, it was about 9 months of chronic symptoms before I sorted out what was causing it and where my mind was contributing, and ultimately figured out how to get better. But your experience lasted, I think, about 10 years. I can't imagine what that must have been like. But can you tell us some about what happened, where you were when it started, and then what that was like in those years when you weren't feeling well?
Yes, I would be happy to. I've told this story many times. So, you know, in hindsight, I think I had mind-body type symptoms even as a child. I had grown up in a stressful environment. Both my parents were alcoholics. There was a lot of screaming in the home. And, but, you know, most children are survivors, and I was a survivor. And I got through that, and I went on to, you know, college and medical school and my medical residency. And from my perspective, I was doing great. I was surviving, I was competing, I was succeeding. I was doing all the things you try to do to make your life good. What I didn't realize, though, was that I was walking around with constant fear-based thinking and fear feelings. But I didn't have the insight at the time to realize that. And it was when I had started my first job, just out of medical residency, when my real symptoms began, the symptoms that eventually prohibited me from working for 10 years. So I was at work. I had taken my first job. In hindsight, I probably would never have taken the job had I known myself better and had I had better self-care skills that I have since learned. But at the time, I felt like I had to take the job. I was in a hurry. And it turned out to be a very stressful job. My department in this academic medical center was the beta test office for electronic medical records. And this was in 2003. And they were creating their own electronic medical record system. So all of this was brand new. And I was getting used to a new job, getting used to being an independent physician, and working for 2 departments, both psychiatry and internal medicine. And found myself up until midnight every night typing notes into the computer and back up at 4 a.m. doing it again. And I was having to type out my own patient letters. So, dear Mr. Smith, your cholesterol level is 200, your LDL is 100. And I found this to be very, frankly, enraging, because I felt like I had trained for 9 years to be a doctor, and yet I was typing letters all day long.
It never ceases to amaze me how the system can take, $100, $200 an hour professionals and ask them to do a job that can be done for minimum wage. Like, it just doesn't make sense. And yet I see it all the time. Like, I don't
Right.
know why we insist that that physicians be data clerks also.
And this was during a time when they had not yet created Dragon Speak or other voice recognition systems. So in this setting, really just 1 month into my job, when I was in survival mode and trying to figure out this new position, I was at work one day and suddenly developed sharp shooting pain in my left elbow. And I had no idea what it was. It was really painful. It wasn't going away. And I went to my doctor and he didn't know what it was. He said, we'll just rest it and it should go away. Well, 1 month later, I developed the exact same pain in my right elbow. So now I had two painful elbows. The pain was starting to spread down the forearms into my hands. And it only came on when I typed, interestingly. I could do other things at home, but when I got to work and started typing, that was when the pain came on. And so this began to get worse over time. I was sent to a specialist, a neurologist, an orthopedic surgeon. My nerve conduction studies were normal. My cervical MRI was normal. I was diagnosed with repetitive strain injury, which was a really popular diagnosis at the time. And I've noticed since then that it's becoming less common, which is interesting. As computers invade our lives more, that diagnosis becomes less common. But at the time it was very in vogue. And of course they did not have a treatment. They recommended good ergonomic positions, and that didn't help. And I was told if you can't type, then you can't have this job. And it was getting to the point where you really couldn't be a physician without interacting with a computer.
That's funny. I remember having a distinct memory of being working at the hospital. I worked here at Northwestern Hospital, and like I came out of the exam room one day and like really hurt my hand. And the very first thought I had was, oh my goodness, I can't be a physician if I can't type.
That's right. Yeah, who would have ever thought that, right?
Yeah.
That you needed that skill. So a few months went by. I went to physical therapy. I took medications for my pain. None of that helped. I rested. I went on medical leave for a little while. But as soon as I came back, the pain was right back. So about a year into this, I was not getting better. I was only getting worse. And it got to the point, interestingly, again, when all I had to do was bend my head down as if I was going to type on the computer to bring on my pain. So the pain began to spread essentially through neural pathways. And so at this point I had to quit work. There was nothing I could do. And I realized that at this time that the conventional medical world just wasn't going to be able to help me. I mean, I knew what they had to offer. I was a physician. I was a psychiatrist. I was an internist. I knew they were out of answers for me. And I began to notice that my physicians began to dread my appointments. They were not happy to see me because I was always in pain and they couldn't help me. And they felt frustrated. We go. Mm-hmm.
What did they do that conveyed that to you? I'm just interested because I know that people listening have had that same experience, but how did you know that they didn't want to see you?
Well, the first time I knew, I went in to see my orthopedist, and I was talking, and about this time I had developed pain in the other arm, but I hadn't yet told him because I knew I was already frustrated. I had pain in one arm and I was trying to make it easy for him to focus. But I mentioned the pain in my other arm. So I said my right elbow pain instead of my left elbow pain. And he said, I thought your pain was in your left elbow. And I said, well, it's in both. It's now in my right elbow as well. And he looked at me as if my impression was he thought I was lying to him and that I had sort of tripped up in my story. And he stood up and he said, I'm not going to do this. And I don't even know what he meant by that, but he stormed out of the office and he basically ran away from me.
That's a good indication.
Yeah.
He's frustrated.
Yeah. And I never saw him again after that, which was really interesting. And I thought, wow, he thinks I'm malingering. And so as a psychiatrist, I was horrified. Here I was, a dual trained physician. I prided myself, just personally speaking, on honesty and forthrightness and doing my best job. And I had just gotten the sense that my physician thought I was malingering, and it was horrifying. It was so insulting. The second time I realized that, I had gone to see a neurologist, and I was very upset in the appointment because by this time my pain had spread across my back when I saw him. And he diagnosed me initially with long neck syndrome. And I looked at him like, what? And he said, oh yeah, it's a thing, look it up. I said, I've never heard of long neck syndrome. And I don't even actually have a long neck, as you can see. I mean, I'm a thin person, but I do not have a long neck. And so I was like, you're kidding, you're diagnosing me with long neck syndrome. But by the end of the appointment, he started to leave, and it was the whole hand on the doorknob story. Hand on the doorknob, he turns around and looks back and he says, I think it's all in your head. And he walks out. And again, I was so insulted. I was horrified because I knew absolutely that I was not imagining my pain. My pain was real. I was not exaggerating it. I was not imagining it. I had not lost my mind. It was happening as I was experiencing it, and I did not have an explanation for it. And I knew my doctors didn't understand it, but I knew it was real.
And, and I just think about like how differently the conversation would go if most physicians had the language to sit down with you at the beginning of the appointment and say like, hey, let me tell you what we understand about pain, rather
Right.
than like, essentially that message is like, it's in your head. I don't want to see you anymore. There's nothing I can do, which is so not true. There's so many things that we can do.
Yeah. Yeah. I mean, it would have been a totally different journey for sure if I had been lucky enough to come across a physician early in my pain journey who did understand mind-body conditions and could talk to me about it. So I left the conventional medical world, and I decided I was going to head out into the alternative medicine world. And perhaps I would be able to find my answer there. I would be able to find out what was wrong with me there. And I spent the next 7-8 years doing every type of alternative medical treatment you could imagine. Chiropractic, acupuncture, herbs, vitamins, hundreds of massages. Gosh, I can't remember the others, but deep tissue massage. I spent 4 months in Pennsylvania once getting daily deep tissue massages to essentially break up the scar tissue in my arms, which was what that person believed was the problem. And tens of thousands of dollars later out of pocket, I was no better. So, but during those 8 years, I wasn't working. Of course, that really affected my self-esteem, and I couldn't figure out what was wrong with me. I thought I had some rare muscle disease. And I couldn't do a lot of research on the computer, ironically, because it was a computer injury. And so it's possible I could have found the answer much earlier if I had really looked for it on the internet, but I tried to avoid the computer at all cost.
Yeah, and you, I'm just thinking, you had just graduated from residency. You had just started working when all this
Right.
started, and you did that dual program in internal medicine and psychiatry, which is
Right.
interesting. I looked at that program when
Mhm.
I graduated from med school in '05 and
Right.
interviewed at the University of Iowa and talked to them about it. And
Okay.
I'm just wondering, I haven't asked you this question before, but what attracted you to that dual program in both medicine and psychiatry, which ultimately, like, you're very well versed in both, more than almost any physician I know. But what were you hoping to do initially
Yeah.
with that dual training?
Yeah. So I initially thought I was going to go into uh, infectious disease, but in medical school, when we started rotating through the different clinics, we rotated through the psychiatric hospital at the University of Tennessee in Memphis, and I just found that I felt comfortable with people who were struggling with mental health. And I noticed that a lot of the medical students did not. And I also knew that there was a dearth of psychiatrists out there. And so my reasoning was, well, if I can do this and there's a need, then I should do this. And perhaps it's my calling. And so I entered residency in psychiatry as a general psychiatry residency. But after about a year into the program, um, I began to regret losing the knowledge I had gained about internal medicine, because it goes pretty quickly if you don't use it. And I always had this gut instinct that, why were they separated? Why were we separating psychiatry from the rest of the body? And even from neurology, it almost seemed like it was a non-medical field, the way it was approached and the way it was viewed, even by other doctors. And that always seemed not accurate to me, and like it really left the patient lacking, good care. And so I just felt compelled to learn both medicine and psychiatry in order to help my patients more. I had also had an interest in alternative medicine, actually, years before, and had considered going into an integrative medicine program. But I was concerned that if I didn't have a conventional medical background, then no one would take me seriously. So I decided to go ahead and go to medical school. And but anyway, so I had always had an interest in how the mind affects the body and how the body affects the mind. But interestingly, you don't learn that in residency. So there was actually no overlap in residency. You learned about internal medicine and you learned about general psychiatry, and the two did not cross. The two did not intersect ever. And I even did, rotations on. We had a locked unit where people with active medical conditions and active psychiatric conditions would be admitted on a locked unit. So, for example, someone with schizophrenia who was psychotic and who also was suffering from cirrhosis of the liver or something like that. So, but again, it was always viewed as a separate problems, not affecting each other.
I remember that, and I had always thought that I might go into psychiatry, but sort of got really frustrated during medical school and looking into residencies about that exact fact, that even sort of like
Mhm.
medicine psychiatry units viewed it as two completely separate entities. And I, like you, had thought about alternative medicine programs, chiropractic, acupuncture, but decided
Mhm.
I needed to be an MD in order to have the authority that I
Mhm.
wanted to have. And so I'm
Right.
struck by similar thinking and similar
Interesting.
backgrounds.
Right.
And
Right.
so, and I started thinking about that because I can't imagine, after going through all the training, what it was like for you not to be able to work for those 8 years right out of the gate. And then it got worse for you after 8 years, right?
Well, it got worse during the 8 years.
Okay.
So, yeah, it was real shocking to have, right when you're launching your life, to all of a sudden be cut short. And it was very perplexing. Over those 8 years, as I was seeking help for my arms, my pain began to spread around my body. And I ended up with over 30 different symptoms and diagnoses. I ended up going to multiple specialists, taking multiple treatments and medicines. I had foot pain, I had knee pain, hip pain, buttock pain. I had hyperacusis, which is sound sensitivity, tinnitus, temporomandibular joint pain. I clenched my jaw so tightly that I cracked multiple teeth and had to have root canals. And then I had food sensitivity testing done. And so then I believed I had over 13 food sensitivities, and my diet became impossible. I couldn't go out to eat. I couldn't socialize with friends, also because of the sound sensitivity. I had rashes. I mean, I think every single, I had constipation. I think every single system in my body was affected at one point or another. And then towards the end of the 8 years, up until that point, I had managed to have all this pain for all these years, but I always slept like a log. So I always looked forward to going to bed at night because I knew I would sleep sound for 8 hours and not have pain. But towards the about the 8th year, I developed my first panic attack. And I knew how to diagnose panic attacks. I had been doing that forever. I knew what a panic attack looked like in another person. I knew how to describe it in a textbook. But when I had my first panic attack, I had no idea what was happening to me. I did not know what they felt like until I experienced my own. And it was horrible. I didn't know what was going wrong with my body. I thought my sympathetic nervous system had suddenly developed some disease process. And I began to have just constant, it felt like 24/7 panic attacks all the time. And at one point I was, doubled over in a fetal position on the floor, crying, while my husband rushed back from Indiana on Christmas Day to be with me. So it got pretty bad. And during this time I couldn't sleep, of course, and had to start taking sleep medications, which were very helpful at the time. But that went on for a year and a half or so. That was a pretty bad point. And it was during that state of things when I called up an old physical therapist, and I was crying on the phone. I was just in a state of desperation. And she said, "Elisa, I don't know what's wrong with you, but I had another patient who had a miraculous recovery from her chronic pain by going to this website. I've never been to the website. I don't know what's on the website, but here it is. Maybe it will help you." And the website was unlearnyourpain.com by Dr. Howard Schubner. And I pulled myself up off the couch and I went to the website, and I promise you, within 5-10 minutes of reading the information, I knew absolutely 100% that I had found the correct diagnosis. It described me, it described my history, it described my stressors, it described my personality traits, it described the characteristics of my pain and my experience with the medical field. This was it. And what was even better than all that, if that wasn't enough, was that it gave me a full path to full recovery. And I was so excited because up until that point, no one had been able to tell me what was wrong with my body, what I was going through. No one had offered any cure at all. I had had a therapist for 2 years who had suggested that I needed to learn to cope with my pain. And I did not want to learn to cope with my pain. I didn't care about any of that.
Absolutely. Was there a specific diagnosis that people had given you, like fibromyalgia or another, or did people just look at it and say, "I don't know"?
Yeah, every little part that hurt had a different diagnosis. So when my feet hurt, I had flat feet. And when my knees hurt, I had osteomalacia of the patella. And when my hip hurt, I had SI joint pain. syndrome. And when my jaw hurt, I had temporomandibular joint syndrome, hyperacusis, tinnitus, uh, repetitive
Anxiety, panic disorder.
anxiety, panic disorder, yeah, insomnia. I mean, it's just descriptors of symptoms, really. You go to the doctor and you say, my muscle hurts, and they diagnose you with muscle pain, only they say it in Latin.
Right.
Fibromyalgia. So they just feed you back what you're telling them. And that's exactly what happened. So, yeah, I did not have a unifying diagnosis. Everyone was always very perplexed, and myself included.
And nobody over these 10 years, because you went to that website, what was that, 2013 when you first,
Unlearn Your Pain?
Yeah, what year was that?
That would have been 2012.
Okay. And so in those 10 years, like nobody you had run into had even hinted that they knew what it was. It's just I know it shouldn't be mind-boggling to me, but it's mind-boggling.
Right. I had one deep tissue massage therapist give me a book once called Taming the Tiger, I think, something like
Waking
that.
the Tiger.
Waking the Tiger, yeah. And I didn't know what this was about. He just said, maybe this will help you. And I opened it up and I'm like, how does this apply to me? I don't even know what this is. And I didn't even read it because I didn't understand that this could possibly apply to my situation, because I was operating with the understanding that I had a physical problem, that my body was broken, that I needed a physical treatment in order to fix my physical problem. I didn't understand at all that it had to do with my mental and emotional state, and my personality traits and my history of trauma. And as I said, I did not want to learn to cope with my pain. I wanted my life back just the way it was. And I wasn't going to rest until I could find that.
Yeah. And so then you found Howard's website. You called him, right? Like the next day?
I did. Yeah. Well, actually that minute, he had his, office number on the website, and I called it expecting his secretary, of course, to answer. And his secretary was sick that day, lucky me. And he answered. And I was like, oh my goodness, like I was so embarrassed that a doctor had answered the phone, And he took the time to listen to my story, and he was just immediately, yes, this is exactly what you have. You have mind-body syndrome, no question. He recommended his book to me. Interestingly, I got the book. I was not able to read it because every time I read anything about mind-body syndrome, I would immediately start to get a panic attack. And I still really don't understand that mechanism, and maybe you do, but so I ended up getting a one-on-one therapist who's trained in this particular form of treatment for mind-body symptoms. And within 2 months, I started getting better at that point.
Yeah, which is amazing. When you said that you started to read, every time you start to read, you'd get a panic attack. I think my thought is just like your body was so on overdrive, like just so sympathetically driven that even the good information would just like activate those pathways. That would be my thought as to why that would have happened. And so
it certainly did happen. And I have heard other patients say that too. Yeah.
And so you started to work with, I think it was Alan Gordon, right?
Yeah.
Who's a friend and colleague of both of ours, and a fantastic person and a fantastic therapist, who also has a podcast with Curable now. And so the two of you worked together. And so what was that journey like? Now that you knew about this and you started to work on it and you started to get better, what did that look like? What did you do, and how did you measure the progress? And just thinking about people who are newer to this information, who are listening, or people who have been working on it for a while and just starting to see some benefits. What happened, and what did you do that helped you improve and ultimately heal?
So I started working with him, and I think it was about 2 months before I even started to notice that things were getting better. And that was probably about 6, 7, 8 appointments in. So it took a little while to get it going. And then once it got going, I think probably after about 9 months or so, I was about 90% better. And I learned a lot during that time. I learned that I have some pretty extreme personality traits that were driving my fear state. These personality traits of perfectionism, of feeling like I have to constantly achieve. I had a lot of people pleasing traits. I just did not know how to say no. Saying no was about the most horrifying thing I could ever do. I had chronic fear thoughts from the moment I woke up in the morning till the moment I went to bed at night. And I learned all of that was driving, this danger signal in the brain. I also learned that I had quite a bit of trauma, emotional trauma in my past, which I knew cognitively, but, I thought that, that happened. I'm over it. I've forgiven. I've gone on. I didn't really realize I still had so many emotions that were repressed around those events. And Alan was able to, gently guide me to understanding that and feeling those emotions in a safe way. And I also practiced a lot, learned and practiced a lot not to be afraid of my pain. Because what I realized was I was going to have to not be afraid of the pain before the pain would go away. It's almost like in some ways I had to befriend it a little bit. And so I practiced and practiced, trying to put my life back together, trying to start exercising again, trying to get involved in the community, kind of reaching out and trying to practice being engaged, essentially. So as a means of practicing going back to work, I thought, well, if I can get engaged on a voluntary basis, then maybe that will help me overcome the fears of going back to work. Of course, I had to practice typing. And so I would type things that I enjoyed writing about, or working on projects that I enjoyed being involved in, and that would take away the fear of typing. I would listen to music that I enjoyed listening to, and that would help me get through the sound sensitivity. And so I essentially spent a year learning how to take better care of myself, learning how to deal with toxic relationships that were ongoing in my life, learning how to say no, learning how to not put myself under so much pressure and to not be so critical, to not scare myself, all of those things. And I found that really the pain was the outer layer of the onion. So the pain went away, but I still had all this stuff underneath that, these rises in anxiety, these feeling anxious about this or that decision or this or that relationship. I remember one of the things that really helped me that Alan taught me was he taught me this mantra that when I heard it, it was like a light bulb that went off for me. And I was in the middle of a difficult decision about whether to handle a situation this way or that way. And I was both ways seemed like they were filled with landmines to me, and there was just no good solution. And he said, well, Elisa, it's going to be okay either way. And that stunned me. I thought, what? What do you mean it's going to be okay either way? It can't be okay either way. Like there's a right way and a wrong way, right? There's a disaster path and there's the feel-good path, right? And he's like, no, like either way, it doesn't matter what happens. You're going to be okay now because you know how to take care of yourself in the moment. You know how to cope with your stressor in the moment of the stress. And so you don't have to prevent it anymore. It's not up to you to control the whole world and control your environment anymore. You can handle whatever happens. and you're not responsible for all these outcomes. That was another bigger. I'm like, wow. I mean, I'm not responsible when someone else gets upset. That's amazing. So, so I learned a lot of really foundational lessons during therapy that has helped me ever since. I should say, not allow myself to get under unnecessary stress,
Yeah,
negative stress.
and all those lessons that you hadn't learned when you were little, like many of
Yeah.
us. And then, you know, what I say frequently to people is that the pain is not the enemy, which is part of what you learned, that you didn't have to be scared of it. It wasn't threatening you. But the pain frequently points in the direction, it points in a direction that's important
Right.
for us. And so the pain ultimately was telling you all these lessons that you hadn't learned that Alan and others were going to teach you.
Right.
And I think that's a hard conceptualization for people just at the beginning too, that pain certainly feels like the enemy. It feels like if we just get it to go away, we'd be fine. But I think oftentimes, or maybe always, it's pointing us towards the lessons that we need to learn.
Yes, absolutely.
Yeah. And so anyway, so you got better, you healed, and then you decided to go back and practice medicine.
I did. And first, I did a couple of things to prove to myself that my pain wasn't going to come back. I did a triathlon, which
Nice.
was pretty amazing for me. I've never been a huge athlete. I've always been an athlete wannabe. And I had always wanted to do a triathlon because my best friend had done one and I wanted to do one. But I hadn't because of fear. And so I thought, well, this is the perfect challenge. I'm trying to get over my fears, right? So I trained for this and I did it, and I placed first in my age group. I won't say what age group that was, but it was amazing. I did not get pain during the event, and I did not even get pain the next day, or 2 days later, or 3 days later, which we often do with mind-body conditions.
Yeah.
And then after that, I did the Paris-Roubaix Challenge in Belgium, which is a bike ride over cobblestones that were placed back in Napoleon's time. And I don't know if you've ever seen these cobblestones, but they are humongous. They stick like a mile out of the ground, it seems like. And when my bike went from the pavement to the cobbles, my neck started to vibrate so hard. My whole body started to vibrate. But I thought, oh my goodness, I think my head is going to fall off of my body. I'd never experienced vibration like that before. And I thought, well, if this doesn't cause pain, I'm definitely cured. And amazingly, I finished the challenge, and I did not get pain. And most importantly, I did not fall off my bike, which I was very happy about. And I didn't get pain the next day either. After all that vibrating for all those miles, it was amazing. And so I knew that I was ready to go back to work. And so I did go back to work, but I started slowly. So I didn't want to dive in. I was worried that my fears, fear pathways would get triggered if I got under too much time pressure too quickly. And it had been 10 years since I had practiced. And so I started back part-time. I started with 1 day a week. And then after a few months, I added a second day, and then I added a third day. And so now I'm practicing as much as I want to practice. And, from time to time, the pain comes back when it can sneak up on you. So I remember even though I do this work now and I help other patients with pain, the pain can still sneak up on you from time to time. It's so convincing, right? Because it's real. And so I remember in 2016, my mother passed away, and I'm kind of the organizer in the family. I organize, I plan things, and so I was planning her memorial celebration, and there were going to be like 50 people at her home, and hors d'oeuvres and flowers and, all the things. And my mother was the hostess with the mostess. That was her. Everyone loved her. She had spent her life having all these parties. And so I just felt compelled to step into those shoes. And at the same time, I was creating this a video of her life. And I had to do all this in 2 weeks. And so on the morning of her memorial celebration, I woke up and I had pain in both of my hamstrings. And I thought, oh my goodness, I've gotten hamstring pain. And I went out and I was like, talked to my husband. I was like, I cannot believe I have pulled both of my hamstrings. What are the odds of that? And he's like, what do you mean? What have you been doing? And I was like, well, nothing really. I guess I've just been walking a few miles every week. And he's like, Elisa, this is TMS. And I was like, really? He's like, Elisa, your mom just died. You've been planning this memorial celebration. You're under a lot of stress. You want it to go well today. It's going to be fine. Don't worry about it. And I kind of chuckled and walked away, went and got my clothes on, walked out the door. The pain was already gone and it never came back.
Yeah,
Yeah.
that's amazing.
Yeah.
When in this process did you start to see or feel comfortable seeing people for mind-body medicine evaluation or treatment? Because I don't think you did that right out of the gate after you started working again, correct?
Actually, I did.
Okay.
That's what I started with.
Okay.
Yeah. So I was trying to decide how to go back to work, and I knew I didn't want to jump right in, doing what I had been doing because I was afraid that would trigger me. So I talked to Howard Schubner and I've forgotten his name, a psychotherapist up in Michigan. And he said,
Dr. Lumley?
yeah, thank you, Mark Lumley. Wonderful psychotherapist, researcher up in Michigan. And I had gone up there and I'd met Howard and I had met him. And I was telling him that I was thinking about doing this work, but I felt like I needed to get trained first in some form of psychotherapy or something. And he said, no, do not do that. And I was like, what? Like, I'm used to like training and then you do something, right? You get a credential or something. And he's like, no, absolutely. He said, go back to Nashville, put up your shingle, start seeing patients now. And I was like, really? And I was terrified to do that because I thought, oh, I can't handle that responsibility. Like, I don't know the treatments yet. And he goes, Elisa, you've lived the whole experience. This is it. And I was like, well, okay. So I thought, okay, I'm just going to listen to these people. They seem to know what they're talking about. And even though I was worried about it, but I went back to Nashville. I opened up a private practice, very small. It was just me. And I started seeing patients and it seemed to go okay. And so it gave me the confidence to get back into regular medicine again. And so that's what I did.
And so you continue to do that at least part of the time that you're working now. And so can you walk us through like what you're looking for when someone comes to see you? Like what kinds of things do you want to know about? What kinds of things do you point out to them? And what would that consultation be like if somebody came to your office?
Sure. So when someone makes an appointment with me, I have them first fill out an intake assessment, which they send back to me before they arrive. And I have them send me some of the most pertinent medical records, such as MRIs, CAT scans, blood work. And on that intake assessment is essentially everything we go over in the appointment. I spend 2 hours with them on the first visit. But essentially, I want to know their pain history. I want to know when it began. I want to know who you've seen, what types of specialists, what types of testing they've done, what types of treatments have been recommended, whether or not they got better or not, what they've been diagnosed with, and what the test results show. But I also want to know whether or not they've had a history of childhood stress, whether or not they've had a history of adult traumas, what their family life was like growing up. Did their parents have any illnesses? I want to know all the symptoms they've ever had. So some people have had 30, 40 symptoms like I did. And so I take a whole body survey of that. I want to know what their personality traits are. So I'll ask them, do you consider yourself a perfectionist? Are you a high achiever? Are you someone who wants to be good and liked? Are you someone who tends to be overly responsible for others? Are you someone who tends to repress thoughts and emotions or repress emotions? So I try to get a feel for if they have the personality traits that might set them up for an experience of chronic pain. And I also want to understand what their beliefs are about what they're going through. Do they feel like all of their pain is caused by the mind, or do they feel like some of their pain is, or are they maybe they're doubtful about the whole thing and they're just coming to check it out? So usually by the end of that first appointment, I'll be able to tell them whether I think all, some, or none of their pain is caused by these stress-induced neural pathways. And then based on their situation, like maybe they flew in from another state, maybe they don't have insurance, maybe they can't interact with the computer for some reason. So depending on their particular situation, I will recommend various online or print-based programs or direct one-on-one therapy. So.
And so say somebody comes to see you and you say, yes, this is a mind-body medicine issue. Like if I were there and I said, okay, I get that. That's why I'm here in your office. But like, how did this happen to me? How do you explain it?
Mm-hmm.
People, or even to yourself in retrospect? Like, what do you think is happening in the body that it shows up in this violent way, even though people physically oftentimes are whole?
Right. So I find that it often is helpful to, in the beginning, explain to them about the danger signal in the brain and how that activates the sympathetic nervous system, and what the purpose of our sympathetic nervous system, of our fight or flight response is, so that they can see that this is a necessary part of being human, and that some people just get these reactions to the degree that it makes them unable to function. But that we all have these psychophysiologic reactions. It's part of being human. So we, many of us have had the experience where our face will turn red if we get embarrassed. We might start to sweat or feel hot. Well, that's just a thought and an emotion causing a real physiologic change in the vasculature of the face. And we have cultural terms for mind-body symptoms, such as the butterflies. We all know what the stomach butterflies are, right? That's just when we get nervous when we're about to perform or speak to somebody. And we all accept that as a given. No one questions that that's a physical symptom that's being caused by a thought or emotion in the brain. And so we all have this and we all know what it is, but we're just not used to talking about it in these terms.
I can't remember who was it that said that about the butterflies. I think it was somebody's daughter's karate teacher, that everybody make sure your butterflies are flying in a row.
Flying in a row. That's cute.
Yeah. And so not to push the butterflies away, but to recognize what they're doing and know that we have some control over them.
Yeah.
And so the danger signals. And so what was causing your danger signals? Then it was the thoughts, right? You had to be perfect. You couldn't make mistakes. You couldn't let people down. Like that's where the danger signals come from, right?
That was one of the things activating my danger signal. And I tend to explain this danger signal. I usually say that, there are essentially three things that can be activating your danger signals. There are these personality traits, perfectionism, high achievers, chronic fear thoughts, people pleasers. But we also have conditioned responses that our brain can learn that can also activate the danger signal in the brain. And we also have these repressed emotions that can activate the danger signal in the brain. And some of these personality traits and the repressed emotions have resulted from past childhood or adult traumas. I explain it that, you need at least one of these things to activate your danger signal, but you don't have to have all of them. And then I'll let them know, based on the history that they've given me, how many of them I think they have. And I also say, but don't worry, if you have all of them, that's okay. I had all of them, and I had repressed emotions. I had conditioned responses. I had personality traits driving it. I had childhood and adult trauma, significant. But I don't think that it makes it any harder to get better if you have more risk factors or more things driving your amygdala. I think it just gives you information. It just shows you which rocks you need to look under in order to develop the skills to get better.
And then what kinds of things do you advise people to do? And so there are a variety of resources out there, Curable being a big one, books that our colleagues have written, various psychotherapists. How would you explain to somebody who you were first seeing, like, okay, this is the initial pathway that I think will help you to improve?
So if I get a sense, a lot of patients will come and say, I had the perfect childhood. I have no trauma. But they're driving themselves constantly. They're perfectionist. They put themselves under superhuman pressure. They're highly self-critical. They can't say no. They're always saying yes to everything. And so they're under a lot of stress, unable to get their own needs met. And if I see that that's the main thing, then I would steer them towards recovery programs that might emphasize the cognitive behavioral techniques that go along with practicing self-compassion, kind of changing that inner voice. I tend to tell people that there are three aspects to recovery, three prongs to recovery. There's the psychoeducation piece, which you have to have. In order to recover from mind-body, you have to understand what is going on in the brain, because it's only then that you can actually work with your mind towards your healing instead of towards your pain. And I think that's what psychotherapy hasn't understood up until this point. They're not talking to the patient about this is what's causing your pain. These are neural pathways. This is how the brain works. And so we're not giving the patient the information to help them work with their brain. So there's the psychoeducation piece. There's the cognitive behavioral techniques piece, which can help you learn to change your relationship with the pain to a non-fear-based relationship. And it can also help you practice self-compassion, taking better care of yourself in the face of stress. And then
I may have told you this story, but I trained in Michigan, and that's how I met Howard the first time when I was a resident. And so we approached the University of Michigan about a study on this for fibromyalgia patients, which ultimately we did, and whose outcomes were great. Mm-hmm. But we were talking with Dr. Dan Claw, who's like the leading, amazing guy, leading fibromyalgia research, and his chief colleague, and we explained what we wanted to do, which essentially was that, like, explain the nature of pain to people and then take them through these cognitive techniques or emotional release techniques. Mm-hmm. And Dan Claw looked at Dave Williams, and they looked back at us and said, "You can't do that." And we were like, "Why not?" It's like, well, then you're testing two things. You're testing a psychoeducational program, and you're testing cognitive behavioral therapy. Like, you've got to test one or the other. And Howard and I looked at each other and we looked back and was like, but if you did one or the other, it wouldn't work.
That's right. That's not the treatment. Right.
But it's so interesting that, like, in the system, like, there's no conception that the two had to go together. Ultimately, they let us do it, and the results were amazing. But everything
is siloed. Your body is siloed into all the different parts and all the different systems. So none are supposed to be communicating with each other. And then your mind and body are siloed, and then the treatment is siloed. Different aspects of treatment are siloed. So it's interesting how we just micro dissect everything and then expect to get a whole outcome.
Yes. So anyway, so you're saying that the educational piece and then the CBT piece and then the third piece that you tell people about.
And then the third piece is if I sense that they have a history of trauma that they may be repressing emotions about, then I'll talk to them about the most commonly repressed emotions being anger, sadness, guilt, and shame. And I'll talk to them about safe ways of feeling those emotions, and that you don't actually have to act them out or become enraged and screaming and running around, that the emotions just want to be felt. But we're so used to thinking about our trauma and telling stories about our trauma, war stories, instead of feeling the emotions that resulted from the trauma. So I think it takes guidance to even know how to do that, to know how to notice the emotions as they arise in your body, to practice the mindfulness you need to practice as you go through your day to be aware of that, and to pay attention to it instead of ignoring it and repressing it.
It's, emotions are such an important part of this. And I always say a few things. One, I find them personally difficult, and I find them a little bit hard to explain to people or teach people, because it's a right-brained activity. Like, it's not logical, but we sort of learn things with our left brain. And so, how do you do that? How do you transmit over? I was thinking about it today, because I personally have worked hard on trying to figure out where are my emotions and how do I find them and express them. I normally think of myself as fairly stoic, but I've done a lot of reading and taught a lot of people about them. And I think at the beginning of pandemic, I was like, okay, my pandemic project is to be better at emotions by the end of pandemic, which I'm still shocked that we're still in pandemic. But anyway, long story short, you know that my father passed away last week, and the funeral was yesterday, and I gave a eulogy, and I was bawling through the eulogy in front of 350 people on Zoom. And it occurred to me in the aftermath, little by little, I've made the emotions more okay for myself, so that there's no longer a voice in my head that says don't cry, Stracks don't cry, and no longer sort of the need to press them down. And so when we think about sort of how people learn for emotions to be safe, like so many other things we teach, I think it's little by little, taking some steps, exploring, sort of feeling like we're not good at it, but sticking with it allows us ultimately to recognize them more easily, allow them to be present, and not feeling like we have to be perfect.
Right. Yeah, that's so important. You don't have to do it perfectly.
Yeah.
It's okay if you don't do it well, many times.
Yeah,
it's okay. We're just human. We're all struggling to get through this life.
Yeah. Anything else that you find important for people to know when they come see you, or sort of in the aftermath of that, as they're trying to figure out what to do to move themselves forward?
Well, I tend to encourage people not to bring their personality traits to their recovery. So a lot of people, when you'll give them all this information, the psychoeducation piece and some general guidance, and they're going to go home and they're going to work through every program within 2 weeks, and then they're going to show back up and say, I still have my pain. But they did all the reading, they were the perfect student, and they achieved an incredible amount, and they were working full time while they were studying this. And so I encourage people not to bring these personality traits that got them sick to their recovery. So don't bring the perfectionism, don't bring the need to do everything yesterday, that they're going to be learning a different way to move through life. And that's going to be a way that's not pushing you, not putting yourself under pressure, not criticizing you if you don't get that 10 minutes of chronic pain homework done that night. So the most important aspect, I say, is learning to take better care of yourself. So to the degree that you're pushing yourself or trying to be perfect in this, you're probably going to be interfering in your recovery. And I encourage them that they're going to recover in their own time. And whatever that time is, that's their time. That's okay. They'll tend to monitor their symptoms from day to day or week to week and wonder why they're not getting better. Again, that's just a pressure thought, and that's going to activate the danger signal in the brain. So I encourage them to not assess their recovery more frequently than every 2 months, say. So if it's January, don't worry about if you've gotten better at all until March. And then look back and say, am I just a little bit better than January? And if you can say yes to that question, then you're on the road to recovery, and it doesn't matter how long it takes. You'll get there.
It's such an important part, I think, of getting better, is understanding that everybody has their own time frame, as you just said, and some people are quicker and some people are take longer. And I've been talking with a lot of people lately about the reasons that people take longer. But yes, I think, we all want to be the best, better getters that there's ever been. And we all have our own time frame, which is the right time frame for us. And I think that's such an important message to pass on, because I know how frustrated people get when it seems slow or even seems like the improvement's not there.
Yeah. And I try to encourage them to start viewing their pain, like you were speaking of earlier. Your pain is pointing you to something. So begin to start viewing your pain as a message from your brain. What is the message? What is my body trying to tell me right now? Is it trying to tell me that I don't like my job? Is it trying to tell me that I'm beating myself up too much? Is it trying to tell me that I'm in an abusive relationship? What is it? So view pain as a message, and begin to pay attention to the body as you move through your day. So, if you start to feel angry, you might start to notice that when you feel angry, your chest gets tight or your throat starts to get tight. You might start to feel hot. If you're feeling sad, your eyes might well up. So begin to pay attention to the body, and what it's trying to tell you. There's a message there. It's trying to communicate with you, and it can't communicate with you in English because it doesn't speak. It's just a neural pathway, right? So it has to send signals, and then we have to interpret these signals.
Yeah, and I talk with people regularly. Like, people will come and see me and they'll talk to me and they'll say, we'll talk about that concept. They're like, no. If the pain would go away, my life would be perfect.
Right.
And part of getting better is understanding what you were just talking about, that the pain is there for a reason, and it's our job to start to interpret what that reason is.
Right. And I tell people, they say, I want to be, I'll often find that patients will come back and they say, my pain's not better. And I'll say, what are you doing? Tell me about your recovery program. And they'll be like, well, I read this and I did that program and I read that and I've read 5 books and I'm still not better. And I'm like, what are you doing? How have you changed? And they're like, well, I guess I haven't. So, they're still beating themselves up. They're still putting themselves under pressure, and they're still afraid of the pain. So you really do have to work the program in order to change. And some people feel like, oh, that's a little scary because I don't want to change. If I'm not a perfectionist, then I may not be successful anymore. if I'm not a high achiever, if I don't put myself under pressure to perform, I may not be able to provide for my family anymore. But I say, no, what you're doing is you're always going to be a perfectionist. You're always going to be a high achiever. That's just who you are. What we're talking about is just dialing it back enough so that you're not bullying yourself with it. You're just dialing it back so that you're not putting your body under so much stress and constantly scaring the danger signal in your brain. And they say, well, I just want to be the person I was. And I say, well, if you work this program, you will never be the person you were. And that's a good thing. Yeah. You will be 100 times better than you ever conceived anyone could be. I'm so much happier now. I rarely ever have stress. I feel motivated to wake up in the morning and start my day and see patients and do my activities. And I rarely ever have a physical symptom. And when I do, it doesn't control my life. My life doesn't revolve around any physical symptoms anymore. Amazing. So I'm not the same person. And thank goodness, because I was miserable and I didn't even know it.
Yeah. Speaking of working the program, you and I are both involved with curable groups. And so I think almost everybody here is familiar with the Curable app. A lot of people are familiar with the curable groups as well. For those who not, it's a 12-week boot camp, essentially going over a number of the topics that we've been talking about. And they've got an information session coming up in a couple of weeks. You and I are both very involved in those groups, meeting with each of the groups, answering questions. What's been your experience of doing that so far? And I can talk a little bit about mine too.
Well, I can honestly say that these curable groups are the most favorite part of my career now. I love them. I look forward to them. It's exciting. I feel so honored to have the opportunity to have come full circle so that I can help others in their chronic pain journey. I feel like I just, they're there from all over the world. That's really exciting. So I'm looking at someone in India or Australia, England, or different parts of the United States. And it just reinforces the fact that this is a universal human response to stress. And chronic pain is also a global epidemic. And I love the questions because I've been there and I know exactly what they're asking me. And I just remember being on the other side and the angst and the worry and the pain and so for me to have come full circle and be able to share my experience and maybe offer some guidance it's just a real honor. And it's a wonderful experience. It's a great group of people at Curable.
Yeah, and you and I, like I said, meet with each of the groups individually. Usually it's 12 people at a time, sometimes a group of 12 that you and I meet with, sometimes it's 24, to answer as many questions as we can get through in a couple of hours. But I agree, like it's such an honor to be with a group of people who are brave enough to be working on pain in this way. There's a lot of pressure in our society to be sick and not take responsibility for what's going on. And so it's a great way to be with people who are working on this, to lend some of my expertise, to share my own personal experiences, to share my now 11 years of professional experiences with this. And then what I say to all the groups, which I think is true, is that by the time people have made the decision to be in the groups, they are on the road to getting better. It's not what they learn. It is what they learn in the groups, but the important point is taking that step to join the group and to make that commitment and to be with the other people who are working on it and the fantastic leaders and all the various topics that help people move forward. So I think it's a really exciting development that they've done over the last couple of years.
It really is. My pain journey recovery was a very lonely one. It was just me. I knew no one else who was going through what I went through. I thought I was a real oddball. I didn't realize there were millions of other people out there suffering. I just didn't know. And so now that Curable's here, and with social media and online platforms, and these curable groups, to be able to walk through that recovery process with other people who are suffering is amazing. Because, I always say, you may have gastrointestinal symptoms and another person may have back pain and someone else may have migraines, but you all got here because of the same danger signal in the brain and the same triggers of that danger signal. And the pathway to recovery is the same for everybody. So even though everyone has a unique story and unique symptoms, the treatment is the same, and the understanding of how the brain works is the same. So I think there must be a lot of bonding that goes on in these groups. I wish I had that in my recovery.
Absolutely. And I think there are information sessions coming up in a couple of weeks on the 23rd. And if people are watching and want more information, they can get it at curablegroups.com. So, Elisa, we've been talking for a long time, which has been super fun. Before we sign off in about 10 minutes, do you have time for a couple of questions
Absolutely.
that people have sent in? And so let me see. Let's see. So other than the Curable app, are there upcoming types of mental practices and techniques that help to manage fibromyalgia that have been catching your attention? And so anything new on the horizon that you've been looking at over the past, say, 6 months to a year?
I'm not sure I understand the question.
Just anything new that's come across your attention that you think is helpful for people with fibromyalgia, other chronic pain disorders, that help to teach some of the, say, CBT types of techniques that we were talking about?
Honestly, I really can't think of anything new other than curable groups.
Yeah.
But one of the things I regularly teach that I think would help anybody with fibromyalgia as well as any other type of chronic pain is this idea. It's really, I got it from Alan Gordon. And he talks about how just like a car has fuel, a car runs on gasoline, and when the car runs out of gasoline, it stops, right? Well, pain has fuel too. And the fuel for pain is fear and attention. And so for as long as you are afraid of the pain, and for as long as you pay attention to the pain, that's all it needs to keep going. And that, the attention can come in the form of a slight thought, but it can also come in the form of, using prosthetics, pillows, props, exercise routines, going to all types of treatment, getting massages, anything that teaches your brain that your body's broken and that you need a physical treatment to fix. So as long as you're afraid of the pain, as long as you're paying attention to the pain, it will keep going. And it's hard not to be afraid of pain when it's all over your body, like in fibromyalgia. But
absolutely.
Yeah.
One of the things that I've been doing during COVID is studying CBT, which I was always a little bit suspicious of in the past. I always thought it was maybe a little bit superficial, but I'm studying a little bit with a psychiatrist named David Burns, who's written a few books on this and has a new book coming out next week. And I'm totally fascinated with it now, because it's about recognizing the negative thoughts, which is so important, and something that until somebody points it out, we don't even necessarily know that they're negative thoughts. and then trying to replace it with positive thoughts. And so not so much like, I'm stupid that I can't get this more quickly, but I'm working really hard on this. And it's frustrating that I'm not going faster, but I know that hard work will eventually get me there. And I always thought like that's what CBT was. But the way David Burns describes it, like the fun starts when you create that positive statement, because then you have to figure out how you're going to believe it, which is
Oh,
much more important than creating it. And he's got all these different techniques and ideas. And so I've been recommending his work to some of my patients, and the ones who are doing it are really finding it beneficial. I would like to find some of his trained therapists and bring them into my practice, because I think it's so useful. But he's got a new book coming out just next week that I think talks a lot of what he's learned in the past 10 or 20 years about taking these mental and emotional steps forward that we're describing. And so Dr. David Burns, I think one of the newer resources that I've been recommending to people.
I know one of the things that I've been recently introduced to by Dr. Schubner is this idea of predictive coding.
Mm-hmm.
You heard about that?
I've talked to him a little bit about it, but Can you explain it a little bit?
Well, to the best of my ability, predictive coding is sort of the current paradigm of how the brain actually works, how the brain creates our experiences that we have in the world. And so it basically says that everything we sense, everything we see, everything we feel, everything we smell or hear is based on these this predictive coding of the brain. The brain uses experiences to estimate what's going to happen in the future. And and then it will produce that prediction. So we tend to think that what we're experiencing is coming from the external world into our brain. But so much of what we're experiencing, while we need the external world to set up the foundation, but so much of what we're actually experiencing in the world, including our experience of pain, is actually being generated by what our brain believes we're supposed to be feeling. So if we believe we're supposed to be having pain because we either have fibromyalgia or because we bent over to pick something up, then the brain just goes, oh, okay, whatever you say, I'll just produce that experience.
He's got a nice story about that I'm sure he's told you, which is, I think the story is roughly like his wife, who is the nicest person in the entire universe, will frequently bring him fruit in the morning as he's waking up and like give him a piece of apple and he'll eat it. And one morning she came in and he was expecting the apple and she dropped it into his mouth and he said it was horrible. Like his initial thought was like, why is Val trying to poison me? And it was a peach. It was a peach, but it was different than what he expected. And so he had this terribly aversive reaction to it when it was actually, it was even sweeter than
Right.
There's a question here said, often listening to these calls and podcasts, somebody said that they will get emotional or tearful, and said, do you ever encounter that in your patients when they come and see you?
Yes, actually I experienced it. So when my sympathetic nervous system was really, really turned on during the time I was having so much anxiety and panic, I would cry at the drop of a hat. You know, I would run across an old friend and just start crying uncontrollably. And I really didn't have any control over extreme emotions, especially sadness and crying. I didn't have an explanation for it, but as I got better, as my sympathetic nervous system began to ramp down and I, developed a calmer state over time, I didn't have that symptom anymore. So, I'm not a psychotherapist. I don't have a good psychodynamic explanation for that, but I think our brains are just in a state of fear and we're just very fragile emotionally because of that.
Yeah, I was thinking when I saw that question, I was like, do my patients not cry when I talk with them about this? And and so yeah, it's very common that tears will flow, and some of it's just about, you know, what you said, the loneliness that goes with pain, and sort of having somebody recognize that this is a real experience, about the validation that comes with knowing that this is real. So many people have had that experience that you had of being dismissed, told you were making it up, that it was all in your head, that you should
Mhm.
stop wasting their time. Like all
Right.
of those that I think are probably even more prevalent in some cases now. But just creating, you know, I see patients for an hour when I see them, you see patients for 2 hours, just creating that space in the container to hear the whole story, to not be rushed, to be believed, to be listened to. My hope, at least, is that it touches people on an emotional level. And so I think that's oftentimes where the emotions come from when I see them in my office. Um, let's see, somebody had asked again, like when you were getting over the fear of the pain, what specific types of activities did you do that was helpful with that?
Yeah. So I tried to be, once I realized what was going on in my brain, I realized I needed to, and even during all my pain years, I felt this need that I needed to keep moving no matter what, because I was so afraid if I stopped moving, then my body would stop knowing how to move. And so once I started to understand what was going on in my brain, I realized I had to lean in a bit to challenge myself to do things that might be scary or might hurt. Um, and and I always enjoyed exercise. It's always been a part of my life. But I would find that, you know, if I ran for a day or two, I would eventually get knee pain. And so what I decided to do was rotate activities. So I would run for 1, 2, 3 days and I'd start to get knee pain. And I knew it was mind body, but I didn't have, it scared me enough. I just didn't feel like I could run through it. So I decided I would just switch activities. So then I would start swimming and I'd swim for 1, 2, 3, 4 days. And then I'd start to get shoulder pain. And I knew it was mind body, but I would just switch activities. And so then I would start biking for a few days. And I kept doing this in rotation, and my brain just wasn't smart enough to realize that I was using all the same muscles, but it didn't know it to create the same pain. You know, it would create a different pain every time, um, and that helped me gradually increase my exercise ability over time. Helped me to gain confidence because I knew if I ran even one time and didn't have knee pain, then that was all I needed. I knew that there was nothing broken because you know, as Alan Gordon says, if you break your leg, it hurts every time you take a step. So if you can find those little windows where you didn't have pain, though you would have expected to have pain, then that's great evidence that this is mind body, and it can give you confidence to keep moving.
Yeah, when I first learned about this 20 some years ago, I talked to Laura about this on a podcast. The first thing I did was get on my bicycle and start riding, and
Mhm.
just kept repeating to myself, it's going to be okay. I'm not damaged. I'm not broken. It took a while on that bike ride, 4 or 5 miles, before it
Oh, wow.
started to calm down. Essentially, it was a flooding technique. I just kept at it
Right,
until it
right.
got calm. And so just going into these activities, coaching ourselves, reminding ourselves, like,
Yeah,
we're okay. Our
yeah.
bodies are stronger than we know.
And I also find that, you know, some people they can be wanting to exercise, but in the past they've always approached exercise as another uh, pressure point in their life, that I have to be fit, I have to, you know, for external reasons, instead of from the experience of true joy when you exercise. So for some people, I think exercise can just be a real trigger because they're pushing themselves to do something they don't really want to do. One of the techniques I used was making sure that when I did do something, that I made sure I was really enjoying it. I was doing it in a way that was fun for me. So when I was trying to get over my sound sensitivity, I would listen to music that I loved, like you know, if you can think of your most favorite song on the planet, the song that gets you so excited and makes you feel like you're like 15 again, you know, that song. And I would listen to that song, and that song happened to be really loud. And I could listen to it and I was fine and I wouldn't have ear pain. But then, you know, a little door would shut and I'd be like, ah.
Mhm.
So if you can turn towards activities that really give you that experience of joy, you know, that a kid has when they're like jumping on a trampoline, that type of joy, if you can find those experiences again, and, you know, sometimes we've never had those or we've forgotten what that feels like. But if you can find those experiences, it's really hard to have chronic pain or have pain when you're experiencing true joy.
Yeah. So it's half past the hour, so one more question and then we will wrap up. But somebody had written in and said they know that their pain is a mind-body issue, but they live in a place where there aren't physicians or practitioners who recognize that. And so thoughts about resources for people who live in a place where they can't easily get to me or to you or to other practitioners who understand this well.
Yeah, we're so lucky to live in the age we do, with so much being online and so many different possibilities for connection. So if you go to the Psychophysiologic Disorders Association website, ppdassociation.org, and you look under the patients tab, there's a find a practitioner list. And if you look under that list, it will have a list of different medical doctors and psychotherapists who do this work. And under their bio profile, it will say whether they do internet Skype work or not. So that's a possibility. You can find people in your area that you may not have known were there. And even if they're not in your area, they may be willing to Skype with you in another state or something like that.
Yeah, and we've talked about the Curable app, the Curable groups. I had mentioned I'm available for remote consultations. The Alan Gordon's Pain Psychology Center in Los Angeles does a lot of remote consultations. All these good books that people have written, Nicole Sax's podcast, which people love. So, you know, I say to people that, as you said, the first step is recognizing what's going on, that the pain is not coming from an underlying physical source. That's the important step one. And then step two is figuring out what resources will work, because it's different for everybody. But keeping looking, grabbing, using, trying, stumbling, getting back up, little by little, putting in the work, people start to improve. And so, you know, the issue these days, people will tell me, is that there's so many resources out there, they get overwhelmed by what to do, as opposed to 10 years ago when, like, you know, Dr. Sarno's lecture and maybe a couple of books. And so one of my patients had the mantra that he wanted to fail fast with all the various resources. Pick one up, try it out. If it didn't work, he'd throw it back and try another. And then he hit on 4 or 5 that were really useful for him.
One of my favorites that I always refer people to is Alan Gordon's multimedia pain recovery program on the TMS wiki site.
It's a great one.
One thing that's great about this is it's free. It's free and online. So many people, you know, don't have medical insurance or extra funds to pay for something. It's a 21-day program. It's fun. It's multimedia. So there are videos. You can watch him interview patients. It's really good at demonstrating techniques such as outcome independence and somatic tracking, which he uses to break these conditioned responses. So it's a really great overview and introduction to this work. It's online and it's free. So I recommend that one a lot.
Yeah, and Curable's wonderful podcasts like Mind Like Body, which you and I have both
That's
been a
great, right?
guest on.
Mhm.
These, which happen regularly, we try to do these every 3 weeks. Alan's got a new podcast, Tell Me About Your Pain, and so a number. I think many of us are committed to, in addition to the paid work that we do, making sure that we
Mhm.
make free resources available for people who don't otherwise have
Mhm.
access. So with that, we will end for this evening. Elisa, thanks so much for being here, sharing your experience and your wisdom with all of us. I know how much people appreciate your openness and your take on all of this. And so if people were interested in contacting you, say for a consultation, is there a way that they can do that?
Sure. Yeah, they can go to my website, elisabatsonmd.com. And on there, there's a contact um, box. You can send an email to me, and it tells you how to get in touch with my scheduler. So, yeah,
Good, thank you.
yeah, we're
And
currently
uh,
seeing
and and
people
thank
virtually. Yeah,
say it again. Sorry.
I'm currently seeing people virtually because of coronavirus.
Sure,
So,
absolutely.
yeah.
And thank you to everyone who's been here and listening and sharing their own insightful questions. Every time we do this, I'm reminded how blessed and touched I am to be part of a community that's willing to do this brave work and work hard and be vulnerable and be creative. As I said earlier, I also am doing remote consultations. And so people who are interested in getting in touch with me can come to our website, www.drstracks.com, and my staff will let you know how remote consultations work. And if you enjoyed this episode, we have all our previous episodes recorded at curablehealth.com/hope for healing. You can sign up for our office newsletter there as well and get updates about upcoming episodes. Curable Groups information kicks off on September 23rd, 2 weeks from now. Curablegroups.com is the location for that. And I will be back here in 3 weeks, Wednesday, September 30th, at the usual 5 p.m. Central Time with Dr. Hal Greenham, who's a mind-body medicine psychotherapist from Melbourne, Australia. And so a little bit of information about how this is being practiced in a different country. And before we sign off, I had mentioned earlier that, oops, that's not what I meant to do. Let's see if I can do this. So sorry, I was trying to get a picture up, which is not going to happen. But I had mentioned earlier, my father did pass away last week, and he was a big fan of this and Dr. Sarno and these Hope for Healings, and a big fan of mine too. And so he was a great person, and I will miss him and dedicate this particular episode of Hope for Healing to him. So with that, good night. Thank you to everybody who has been listening and stuck with us for this time that we've been on. I will see you again in 3 weeks, and I hope everybody has a great rest of your evening and continues to stay safe and healthy. So thanks, Elisa. And
Thank you, John. Appreciate it.